Hello, welcome to this new podcast. My name is Dr. Ahson. I'm a professional researcher, and with me is Dr. Shamim Qazi, who's my old friend, and he's a doctor who's currently based in Geneva. He specialized in as a pediatrician, and he's going to share with us his experiences. And Dr. Shamim, please kindly introduce yourself, where you got your earlier education, and about your experiences.
Thank you, Dr. Hassan. Yes, I'm Shamim Qazi. I got my medical graduation from Peshawar, Khyber Medical University. And after that, I went to National Institute of Child Health in Karachi and did some training in diploma in pediatrics, followed by coming back to Islamabad, working at the Polyclinic Hospital and then Children's Hospital, Islamabad. I also did in between my MD in pediatrics and a master's in human nutrition. I worked for about 20 years as a clinical pediatrician, working clinical services and also doing some research plus doing some community work. And in 1997, I went to WHO to coordinate research in childhood illnesses. Obviously, I've seen a lot of patients doing all this work, but one of the instances which I remember, and which relates to a friend of mine also, was that a friend of mine had a 3-month-old daughter who developed some kind of rash and a fever. And she was taken to a medical center near their home in Islamabad, where she was given some Phenarcan, which is an anti-allergic medicine, plus some other medicines. She got better, but not fully recovered. So somebody advised them to go to see a homeopath in Islamabad. He was very famous. And so they went and showed their daughter to that homeopath, who, after examining her, said that there is a disease which is inside her body and it needs to be brought out, for which he will give a medicine which will result in some difficulty for the child. Child may develop some rash, etc., but that would be good because the disease will be then out of the body. So he gave some medicines. Homeopaths use small little tablets, and after taking that medicine, that daughter of my friend became very sick, and she developed extremely high temperature and also very severe rash all over the body, which was not exactly simple rash. It was a complicated kind of rash. I was not aware of this, and I just returned from UK after my postgraduate studies, and I just went to see them at a social call. And when I saw Fiza, she was, very sick, and she was only 3 months old. They had again gone to that homeopath who had told them that their daughter had suffering from measles. Measles usually occurs, later in life, 1 year or plus. That's why we give the measles vaccine at 9 months of age. So she didn't have measles, but she was very sick. So I advised them that we should go and see a dermatologist because the rash was not looking good. And they said no, they wanted to wait for another day to see whether the child will do better or not. So next day I went to see the child again, and it was again same issue. The child was still very, very sick. So then I called a professional colleague of mine who was a dermatologist, a skin specialist in another hospital in Islamabad, and I requested him to see this child. At that time, Friday used to be a weekly holiday, so it was a Friday. And but that doctor was very kind, and with professional courtesy, he agreed to see the child. And as soon as he saw the child, she said, no, she needs admission. So then
She was serious that she needed
admission. And then, during the hospitalization, she was treated with, injectables and other things to to basically treat that severe rash, which was basically an allergic reaction,
Yes.
and also had fever because of some viral infection which she had. And later on, she was diagnosed as having been allergic to several things, including fish and others.
Mm.
It took about 4 or 5 months for her to fully recover from that illness.
Yeah.
But it shows you that an appropriate diagnosis is important in order to identify and manage a child who is sick, and that I don't have anything against the traditional and alternative medicines, because many times they work very well, and if managed by an experienced person, they can help people. But in this case, it was not happening, and the child became very sick.
Well, just a comment about this. The diagnosis she was given first, that this cliche that there is something inside which needs to come out, and the second misconception that homeopathic medicine does not have any side effects, whereas this case shows that there are side effects, and very serious side effects if it's not if a appropriate diagnosis and medicine is not given. So what would you say about this to the audience?
Even homeopaths believe and know that if the wrong medicine is given after the diagnosis, it can create a lot of problems. They actually
are aware of this.
Yeah, they are aware of this. So this can happen. Like it can happen with the other allopathic medicines also. So one has to be careful, and taking a good history and doing a good examination is always important to establish diagnosis. And then suppose one cannot establish a diagnosis, then one should seek help from more experienced or a specialist in that matter.
And also, one of the strengths of the modern medicine has been the diagnosis. Not only the diagnosis by the doctor, but also the tests available, the standardized tests. What do you say about the alternative medicine? Is there something similar available, or is just the physician skills which are the chief determinant of where the treatment is going to go?
As far as I know, the alternative medicines do not use any tests, etc. But I do know from our part of the world, alternate medicine is very commonly used. Hikmat is very commonly used by many people. Homeopathy is used by many people, and many people get better from it also. But in general, I don't think they use any laboratory tests to help them diagnose anything. It's mostly their experience which actually works in their favor for them.
Okay. Well, which can be a very dangerous situation.
Personally, yes.
Like this one is that somebody's life could be at stake. Could you also briefly share with us your experiences while working at the WHO, where you specialized in pneumonia, I believe, and a preventable side of this, the education of the population at large, and the earlier diagnosis, access to healthcare, and how important these are, and how many lives could be saved if this aspect is dealt with properly. And how much progress has Pakistan made in this regard?
Thank you very much, Ahson, for asking this question. Pakistan has made a lot of progress, but there is still a lot of room for improvement. At present, when I started working in pediatrics in 1980s, it was estimated that nearly 13 million children under 5 died every year globally.
Okay.
Commonly due to pneumonia, diarrhea, malaria, and neonatal infection, the neonatal problems. Now, fortunately, we have gotten in a way much better, and current estimates of annual global deaths are 4.8 million, which is about 50, 60% less than what it was there at that time. But by virtue of my starting the work at that time, so my interest in pneumonia, which was a very large killer, and diarrhea, which was also a very large killer, was initiated. And since then, I've been working especially on pneumonia, and I've done a lot of research on that also. And because of that, I was asked by WHO to join them and to coordinate research on common childhood illnesses. WHO is a very special organization. It is a technical organization, but at the same time, its mandate is to help countries improve their health. Most of the developed countries like Europe and America and others, they have very advanced medical systems, but which is not the case in many low resource settings in low middle income countries. So my job in WHO was to help identify simple ways of diagnosing common illnesses like pneumonia, like sepsis in newborns, etc. And then also to find simple and accessible ways of managing those illnesses so that sick children and babies could be treated near their homes instead of them traveling for because in many places the nearest facility may be 20-25 kilometers away. By the time you reach there, it's already too late, and some people have to walk those 25 kilometers. They don't have money for the transport and other things. So one of the things that we did, and my colleagues and others in WHO, was to develop simple management algorithms which help first level health facilities to manage many of these children at their level. And if the health facilities were further away from the villages, etc., then train lay people in the communities as community health workers so that they could identify these common illnesses there in the community and manage them with simple methods. But we differentiated the diseases by those which had severe signs and by those which had less severe signs. So the less severe signs could be treated there by the community and the first level facility people. But if the child or a newborn had serious signs, which we call danger signs, and we would teach those to those workers, then those people, those children would be straight away referred to a hospital. It's not that every time they were referred to the hospital, they would go there, because there are lots of other things, economics and food and family and other responsibilities. But that was actually the objective, to bring the management of common illnesses, simple illnesses, near their homes so that we could save lives. And, with this, with improved vaccination coverages, improved nutrition, and with time, water supply and toilet services, sanitation, etc. There are a lot of work going on these things also. And these have all helped in reducing this child mortality from 13 million to 4.8. Still, it's a lot. That means there's still 37 out of 1,000 live births are dying. And the SDG, which is the Sustainable Development Goal, is that we should decrease it to 25 per 1,000 by 2030. We're not there yet. But a lot of progress has been made, and a lot of progress needs to be made in order to achieve that target.
Just like 3.7% and should be down to about 2.5%. To its natural level.
When I started working in this area, it was nearly 100 per 1,000.
10%.
Yes. And Pakistan, unfortunately, is still one of those countries which contributes a lot to still these deaths.
Sure.
It is the first top, I would say, 5 or 6 countries which contribute a lot to these number of deaths. One is by virtue of its population.
Yeah.
But second is also the health systems and other things need a lot of work still.
It's unfortunate, given that, where we started and when the work was started on this one, and the number of health professionals we have, and and the number of hospitals and everything which we have. So it's quite unfortunate, though.
But there are still areas in Pakistan which have poor access to health services.
Thank you so much for sharing this with us. We'll collaborate on another video, hopefully at some other time. Thank you so much.
Thank you very much. Bye.